Dr. Zac Keenum. I'm an oculofacial plastic surgeon here at Vance Thompson Vision. And what that means is I do plastic surgery that primarily is focused in this area. So it's subspecialized training that we do after an ophthalmology residency. So I'm trained in ophthalmology and then I have extra training to do plastic surgery just on the eyelids and eye socket. So by and large, what I do most of, I would say 80 to 90% of what we do is blepharoplasty. So we're doing a lot of hooded eyelids. So patients with droopy eyelids, hooded brows, heavy brows, excess skin of the upper eyelids. We're doing a lot of blepharoplasty for that. So that's probably our most common procedure that we do. Something that patients like to pair with that is oftentimes they'll have heavy under eyes where they have extra skin under the eyes or puffy bags or dark circles. So that's a lower blepharoplasty, and that's something that we'll often pair with upper eyelid surgery. They can be done together or separately, but patients often like just one downtime, so we'll often pair them together. And what that looks like is often removing some of the fat from underneath the eye to get rid of the puffiness. Oftentimes I'm moving fat up into the deeper tear trough and into the mid-face from the belly. I'll actually do small volume liposuction and rebuild the cheek and the tear trough hollows. At the same time removing some fat above, removing any excess skin of the lower eyelids, and I like to laser this area to tighten the skin and help with fine lines and wrinkles. So that's a lot of what we do. We also do some reconstructive procedures. So today, for example, I had a patient who had skin cancer of the lower eyelid, had it removed by the dermatologist, left a large hole in the eyelid, and then I'm able to fix it and reconstruct the eyelid. So it really spans the whole scope of eyelid surgery, from cosmetic surgery on younger patients with the lower blepharoplasty, the puffy under eyes, to reconstructive surgery of the eyelids. So some of the common concerns patients have when they're thinking about eyelid surgery or plastic surgery, or as we call it, oculoplastic surgery, around the eyelids is: one, is it going to be painful? What's the downtime going to look like? And am I going to be bruised and swollen? Those are probably the three most common questions that we get. To answer those one at a time, the first one, is it painful? We sedate patients. We do what we call a twilight sedation. So the nice thing about it is patients don't need to be completely asleep, meaning they don't need a tube down breathing for them. They're awake, breathing on their own, but we put an IV in, we get them nice and relaxed, and we do what's called a twilight sedation, where they really drift off the la-la land and really just don't mind what's going on while we're doing the procedure. Once they're nice and relaxed, I'll inject a little numbing medicine in the area we're going to be working, and we try to make that as comfortable as possible. Once that's in, patients often just sleep through the whole thing. So generally not a lot of pain. In the post-operative period, there's also typically not much pain. Patients don't experience a lot of pain with eyelid surgery by and large. At most, patients tend to tell me they take 2 Tylenol. We don't prescribe any narcotics for these types of surgeries. So by and large, eyelid surgery is not a painful surgery. The one thing we can get, to answer our second question, is downtime and bruising and swelling, or rather our second and third question. Is the downtime, we normally tell patients to take it easy for about a week, meaning we don't want patients picking up more than 10 to 15 pounds, bending down at their waist or straining. Anything that's going to raise their blood pressure, we avoid for 1 week. We have patients come back after a week from the time of surgery, and then we'll remove any sutures, take a look, make sure things are healing well. We let patients kind of ease back into their normal life after that time, so we tell people to expect to be taking it easy, doing light activity for about a week. They can still drive, they can still work from a computer, just nothing too strenuous or a lot of physical labor for about 6 to 7 days. We do tell patients to expect some bruising and swelling for probably a week or 2, so it's certainly possible to get some bruising and swelling around the eyes with this surgery. We have a pretty rigorous protocol when it comes to doing ice and compression in the immediate post-op period for the first few days, and that tends to really reduce swelling and bruising if patients adhere to it. But we still let patients know it's possible that you'll have bruising and swelling for a couple weeks, and that's something that they should expect.